pets. I mean, just this one keeps coming up. I don't know where we're up to. Can people get their pets? Do they have to isolate? Can somebody else pick it up?
Yeah, people can go over and collect their pets, but obviously when they return to the island, they must isolate for the 14 days. If someone else is collecting the pet for them and brings it into the island, the pet must isolate with that person until their isolation period is completed.
A Manx rumour, and we might as well deal with them. Hearing from a reliable source that vaccine is being thrown away at the end of the day at the airport. This needs investigating and answering quick. There are key workers very local to the airport who would be happy to be vaccinated rather than waste it.
Right. In terms of wastage, there will always be some wastage with vaccination, but 111 has a list of people who are in the different cohort groups that they can call at short notice, and they have been doing so. So people who can turn up with an hour's notice. In fact, I was speaking to, funnily enough, a taxi driver yesterday who's in one of those cohorts who's been requested for vaccination. He said he was rung up the other day by 111 and asked to go down at an hour's notice to be vaccinated.
Fantastic, wasn't it? Just get that.
So I'm getting the feedback that system is in place and working.
Okay, I'll go on that list anytime. Could I ask you, sir, to publish projected timetable for vaccinating each JCVI group, stating that all over 50-year-olds completed by end of May? This will mean which will mean approximate dates and amounts of vaccine deliveries have been matched to the number of each group. Does that make sense?
Yeah, we can't publish the amount of vaccine or the deliveries. That information's owned by Her Majesty's government in the UK, and they have made quite clear. People may have seen in the newspapers the argument between the UK government and the Scottish government. The UK government is not willing for their vaccination delivery schedules to be published. If we publish the delivery schedules to us, then people mathematically, because they know we're getting it as a per head of population, can work back the UK vaccination deliveries. So HMG was not willing to allow us to publish the vaccination schedules in that way. The information we can give is that all priority groups over the age of 50 will be vaccinated on current timelines by the end of May.
And more on the whole thing about timelines, catch up. When there are weekly vaccinations, are still less than the UK, but we've done that one. Are you happy?
The only reason it's less is because we are reserving the second doses. Yeah. So whereas the UK is firing every single vaccine they're getting into people and reserving nothing for the second dose and hoping that the supply lines hold up in order to provide that second dose, we are taking a more cautious approach and we are holding back the second dose. So if people go onto the website covid19.gov.im/vacstats, they can actually see that, because there is actually up in the corner a thing about the number of vaccinations in stock, so people can see how many vaccines we are holding for second dose. And
this will be the same then. Speaking to a couple of friends living in Edinburgh at the weekend, they are the same age of us, 68. They've been told they have their appointments for their first vaccination this coming Wednesday. How does the Isle of Man compare with that timeline? Are you the same thing?
Yeah, so again, there will be a slight delay in the different age groups because we are holding back the second doses, but in terms of the amount of supply we're receiving, it is the correct proportion of the UK stock.
And when we've done with the past about health workers, will they be made to take the vaccination for starters?
It is at this point a personal choice. There is no compulsion.
At this point, though, that something might move? Okay.
Well, no, I don't see any reason at the moment for. I've not seen any signs that suggest they must. Vaccination for flu, for instance, is a personal choice with NHS staff. Not everyone must have it, and I see the same being with the COVID vaccine.
Finally, I want to deal with the steam packet. And we had this story, didn't we? We talked about this whole thing, and now it came up in Tynwald or House of Keys, whatever. Yeah. There was a problem, wasn't it, really? I mean, it appears that this is a potential area of concern.
Well, it is always an area of concern, but that's why the steam packet has protocols in place. The first thing we've got to mention about the steam packet is, of course, that the vaccine protects the person. So it will stop the person becoming seriously ill, but it doesn't necessarily stop the person, if they contract COVID, passing it on to someone else. We know from the current reports that are coming out, although they still need to be peer-reviewed, so they're not guaranteed, but it's looking encouraging that having the vaccine does cut transmission by 67%, but it doesn't remove transmission. So if someone on the steam packet was vaccinated and contracted COVID, it does not mean they can't pass it on to other people, and that's why it's still important that we have the protocols in place where the staff mix as little as possible with the passengers.
And what about UK to Manx crews though as well?
Well, again, that wouldn't help with the resilience of the steam packet, because even if someone is vaccinated and they contract COVID, they would still have to self-isolate. Right. So it doesn't improve the steam packet's resilience in terms of
So they're not going to get priority
staffing.
then?
So at the moment, no, we're not looking at that at the moment. I know it was raised by a question by Mr. Robert Shaw, and it is a risk, as the Chief Minister said. We do ask our medical team to look at this constantly, and if they believe that the situation changes, then we will go with the medical advice.
And we all know it only takes one of these sort of problems that happen that we're into another lockdown, another £20 million put aside. I mean,
But to be fair, it's the same with every risk we take, Paul. There is always that risk. There's that risk with passengers on the steam packet as well. Yeah. There's that risk with people in isolation who may not follow the rules. That's why the steam packet have such strict protocols in place around the way that they operate.
Well, thanks for talking to us in person. I love it. This is great, isn't it?
I was going to say, it's great not to have to worry about Skype.
So any more questions that we'll do another one, I guess, next week? Well, as long as you keep going. News@manx.net. Do send the questions in. Thank you for your time. I know you're very busy here doing lots of media. You've been on the telly all over the place this week as well.
It's been interesting. Let's put it that way.